If your doctor or derm put you on antibiotics for acne and your skin cleared up beautifully, only for your breakouts to come raging back a few months later, worse than before, then what I'm about to tell you might make you angry. Because according to the science, the very treatment that cleared your skin may have increased the chances of your acne returning. And there's one crucial thing doctors and dermatologists are supposed to do alongside antibiotics that many women are never told about. Today, I'm going to show you the shocking science behind what's known as super acne and why millions of women are trapped in a cycle of clearer skin followed by devastating relapses. Hi there. My name is Cheryl Woodman. I'm a scientist, acne expert, and award winning skincare formulator, here to help you get back to your clear, calm, confident skin. And I know there are facts about this antibiotic versus benzoyl peroxide face off that your doctor or derm isn't telling you. And these have serious implications for your skin's ability to get clear again. Look. Antibiotics were first used to treat acne way back in the 1950s. Doctors thought they had discovered a miracle cure for acne, a simple prescription you could take for a few months and your skin would clear up in weeks. It was pure relief for patients who had been struggling for years, sometimes even decades. But then something started to happen. And what scientists discovered next completely changed how we think about acne treatment. In fact, by the end of this video, you'll understand why one of the biggest weapons doctors use against acne may actually be helping create the problem it's trying to solve. See, this miracle prescription for some people stopped working. And it didn't take long, just a few decades later. By the 1980s, papers were beginning to report that acne patients were not responding well to oral antibiotic treatment. Since then, there have been some truly shocking discoveries when it comes to antibiotics and their usage as an acne treatment, including this terrifying statistic that many countries have now reported over a 50% acne bacteria resistance rate to antibiotics. This is super acne, and this means if you're given a prescription of antibiotics for acne, you'll likely have less than a 50-50 chance of getting clear. And even if you did get clear, your acne is likely to come back just weeks after you stop. And I'm going to dive into that science with you soon. What most people don't know about taking antibiotics for acne is that it's been linked with an increased risk of other health conditions, for example, IBS and upper respiratory tract infections. And the science can get a tad shocking on the increased risk. For example, this study shows that if you've taken antibiotics for acne, you are 2 times more likely to get an upper respiratory tract infection within the following year. So not only can the acne treatment not work, but it can also cause you other health issues. That's kind of crazy, right? Knowing this, international guidelines summarized here by the Yale Journal of Biology and Medicine strictly state that oral antibiotics should only ever be used for 3 months maximum. Yet, millions of women are prescribed one antibiotic prescription after another and another. When antibiotics fail them, they go back to their doctor, and the answer is often, here, take another 3 months of antibiotics. If your doctor or derm never told you this, hit subscribe, because if you don't, you might never see me again. Have you done that? Wonderful. See, the science now proves the longer you are on antibiotics for acne, the greater your risk of acne relapses. So the very treatment supposed to help could actually increase your risk of super acne, of being stuck in this constant treating healing cycle, feeling like nothing works. But here's the truly scary part. Most women think this only happens after years of antibiotic use. The science you're about to see suggests it can begin much sooner than most people realize. The truth is if you hit the 12-week point of taking antibiotics for acne and you still have 5 to 10 breakouts left, 67% of doctors will blindly issue another 3-month cycle of antibiotics, even though the guidelines state they should switch you to another treatment and that this would give you a higher likelihood of a better outcome. It's like getting a haircut you don't like and then going back to that exact same hairdresser again. When scientists tracked acne patients, they found that extending antibiotic treatment for acne actually caused worse long-term outcomes. Patients on extended antibiotics saw their 12-month recurrence rate skyrocket from 23.8% all the way to 46.3%, which is what this science paper shows. The conclusion was staying on the pills longer literally doubles your chances of your acne coming back. Isn't that wild? This is how you can get trapped in this constant treating healing cycle where you're seeing clearer skin for a few months and it feels so freeing. Like, finally, this is it. But then when you stop the meds, just months later, sometimes sooner, your acne comes flaring back way worse than before. And it's devastating. It might be sucking away your confidence and your self-esteem. And the whole time, the secret that derms and doctors don't tell you is that it's increasing your risk of super acne and making it much more likely your acne comes back worse in future. But that's not going to happen to you because you're here with me right now. And your first step to jumping off the antibiotic merry-go-round is to identify your unique combination of acne types, because only when you know what your real acne types are can you actually discover what your skin and body need to heal. For example, if you have hormonal acne, why are you using antibiotics for acne? I have a free 10 acne types quiz sheet download that's going to help you discover this in just 60 seconds. I'll leave the link in the description. You want to grab your free copy because honestly, understanding your acne types is game changing and it's usually the first step that breaks you free of this constant treating healing cycle. Okay, now you've got that, you might be wondering, why on earth would a drug designed to kill bacteria make your acne twice as likely to return? Well, that's because acne bacteria do something no one expected them to do, and it makes them super sticky in your pores. See, acne bacteria have this ability to form what in science we call biofilms. Okay, so that's a super fancy sounding science word. And here's how we easily remember what this means. A biofilm is like if you were staging a protest in a building about to be knocked down. Maybe Hotel Chocolat. That's what I would definitely be staging a protest for. Well, you and I and your friends, we're sat outside the front of the building. And police are trying to remove us from the premises. They start trying to pick us up one by one, and they're succeeding. They're taking your friends away, but then we fight back. We all agree to hold hands with each other. Now the police can't pick anyone up because if they do, they're trying to pull you all away together, and they're just not strong enough. This is what a biofilm is like. It's like lots of bacteria all holding hands, and it makes them super sticky in your pores. They're way harder to get rid of. See, we know that this ability of acne bacteria to stage a hostile takeover of your pores is one of the factors that likely speeds up the development of antibiotic resistance, just like this science quote tells us. And it makes sense, right? If acne bacteria have this special power that makes them extra sticky in your pores, they're used to surviving and adapting through even the strongest treatments. Now, imagine what happens when your pores have biofilms of acne bacteria that are antibiotic resistant. That's when you start to feel like you're a complicated case and nothing ever works. But I promise there is a way out. And that's why my acne warrior method focuses on naturally making your pores a hostile place for the acne bacteria and a comfy couch for the good bacteria. It's completely different from how antibiotics work, and it uses natural shifts to your diet and supplements to achieve it. If you want to find out more, find the link in the description. And you'll want to check it out because once you see this shocking fact, you'll never want to use antibiotics for acne again. See this study? Well, it tells how bacteria within a biofilm are 50 to 500 times more resistant to antibiotics. 50 to 500 times. That's skyrocketingly different to normal acne bacteria. That's why super acne can be so incredibly resistant to treatment, making you feel like nothing the doctor prescribes ever works. And why you should really question your doctor or derm if they don't put you on a combination of antibiotics with benzoyl peroxide. And if you give me a minute, I'll tell you why it's so important you advocate for this. It would also shock you to find out that I'm not a fan of benzoyl peroxide and I would never recommend it within my Acne Warrior program. But even though I passionately am against its use for acne treatment, I believe you deserve to know the science. See, benzoyl peroxide has been shown to reduce antibiotic-resistant C. acnes strains. This is why the first treatment that your doctor or derm should be discussing with you is benzoyl peroxide, and why doctors and derms are recommended to never prescribe antibiotics as a monotherapy, meaning it should always be in combination with benzoyl peroxide. If your doctor or derm didn't tell you this, will you please like this video so it reaches other women in need? Thank you so much. Okay, now you've done that, let me show you the standout reason why benzoyl peroxide should always be prescribed with antibiotics. Because to date, there is no evidence of acne bacteria becoming resistant to benzoyl peroxide. I describe benzoyl peroxide like a Dalek, and in this way it truly is. Nothing, not even the strongest acne bacteria, are stopping it. Now you understand why benzoyl peroxide is so important in combination with antibiotic treatment. Don't make the mistake most people make next, because not all benzoyl peroxide products are created equal. In fact, one of the most popular options can leave your skin irritated, flaky, and ready to quit before it ever starts working. So before you spend a penny, click this video right here, because I'm going to show you exactly which benzoyl product I would choose if I was starting from scratch today. And if you don't see that video live just yet, click this subscribe button and I'll see you in a week.